Hello, call me Juliana. I study radiology technologist at UTFPR, with teacher Katja Prusa, in Human Anatomy 1. And I'm going to talk about temporomandibular joint. What is ATM? The temporomandibular joint is the main connection between the skull and the jaw. Its main function is to allow the opening and closing of the mouth, as well as the movements of chewing, speaking, and swallowing. Anatomy of the TMJ. Considered the most complex joint in the human body. Structure of the TMJ. Mandibular fossa of the temporal bone. Articular disc. Head and condyle of the mandible. Adjacent ligaments. Articular cartilage. Synovial membrane. Articular capsule. Articular surface. Temporomandibular dysfunction. TMD is an abnormality in the functioning of the temporomandibular joint, a set of problems that affect the TMJ. In other words, wear and tear and problems in both muscles and bones. Around 75% of the population has already experienced this or will experience it, and around 5 to 7% of the population suffers from TMD and undergoes treatment. Symptoms: headaches in the forehead, back of the eye and temples, earaches, ringing in the ears, difficulty chewing, especially hard foods, pain when chewing, dizziness, vertigo, noise near the ear when opening and closing the mouth, excessive dental wear, feeling of the jaw locked. Causes: clenching or grinding the teeth, bruxism, muscle tension, incorrect chewing, crooked teeth, biting nails, biting the lips. Treatment: there are several ways to treat pain caused by temporomandibular joint (TMJ) dysfunction, each of which is associated with the type of cause. Bite splints, physiotherapy, medication, prevention. Preventing temporomandibular joint problems involves practices that minimize stress on the joint and associated muscles. Maintaining good posture, avoiding chewing on hard objects, and not supporting your chin with your hands are simple measures that can make a significant difference. Conclusion: the temporomandibular joint plays an essential role in chewing, speaking, and other daily functions. Its proper functioning depends on the balance between muscles, ligaments, and bone structures. When there is dysfunction in the TMJ, the symptoms can significantly impact quality of life. Therefore, prevention and adequate treatment, through healthy habits and professional monitoring, are essential to ensure well-being. Thank you for your attention.